So yes, we're live streaming on YouTube. Ooh. So just 1 second. So yes.
Hello there and welcome to another interesting discussion on Medical Mondays with Dr. O. Medical Mondays bring you intriguing chat on health and medical information as we discuss health issues for a better lifestyle. Be reminded that we are not establishing patient-doctor relationship with you, but rather giving you relevant information to accord you good health and good future. This edition we'll be talking about gum diseases. And so please stay tuned. If you are joining us on Facebook, on YouTube, we are live over there too. And remember to catch up on previous editions of Medical Mondays with Dr. O by joining the channel Medical Mondays with Dr. O on YouTube. Remember to hit the like button and subscribe so you will get all the latest programs when it comes your way. Dr. Toyin Opeyemi is a family practitioner, CEO of Gennesaret Medical Center in Maryland, and she is committed to changing lives through healthcare. Dr. O, you're welcome.
Thank you so much. Appreciate you, Honorable Gustav. We have another exciting night on Medical Mondays with Dr. O tonight. We have Dr. Adewole Opeyemi, a senior registrar in periodontology, is in Nigeria, zooming in now at 1 a.m. Nigerian time. Is a senior registrar, as I said, in periodontology unit of the Department of Preventive and Community Dentistry, Obafemi Awolowo University Teaching Hospitals Complex in Ile-Ife. That's in the southwest of Nigeria. He obtained his Bachelor of Dentistry, Dental Surgery degree and Master's in Public Health from the prestigious Obafemi Awolowo University, Ile-Ife. He is a certified professional in monitoring and evaluation of public health programs. He has practiced as a dentist in both private and public settings for over 14 years. He is a member of the International Association of Dental Research, Nigerian Division, Nigerian Medical Association, Periodontist Association of Nigeria, National Association of Resident Doctors, OAUTHC chapter, NCD Alliance Osun State chapter also. He is currently the secretary of the Nigerian Dental Association, Osun State chapter. He is happily married and blessed with children, and he gives back to the community. If you all remember when Dr. Jagbe was going for medical missions to Nigeria the first time, sometime last year, he connected through Medical Mondays through me to Dr. Jagbe, and he kept his word, participated in that mission, and since then has participated with Dr. Jagbe in several missions in Nigeria, blessing thousands of Nigerians, giving back to just make sure they have a strong health and a strong future. So we are blessed to have Dr. Opeyemi Adewole on the forum, and thank you so much, because I know this is bedtime, 1 a.m. in the morning. Welcome.
Thank you, Dr. O, for that introduction. I must say that I'm excited to be here once again. It's been another opportunity to connect with people out there. And I must say that I appreciate all that you have been doing as far as the health issue is concerned. And I want to appreciate my guys in the house. I've had quite a number of interesting contributors, I know, professionals. So I want to appreciate you, especially my Professor Oluwole Ajagbe. I believe this time is going to be a nice time. Let me just go quickly to my slide. Thank you. Well, today we want to consider one of an important topic that is not often considered important by the public, but by virtue of what we have been doing at the Medical Mondays, is another time to cap it up with oral health, because some of all these things about the health are connected. The topic before me is prevention and control of gum diseases, major keys to an optimal general health. I'm going to follow. This will be our learning objectives: to know the causation and risk factors of gum diseases, to understand the pathogenesis and as the basis for prevention and control, to create awareness on possible links to systemic diseases, and to gain insight on prevention and control strategy for gum diseases. This is my outline. By way of introduction, this is the definition given by the FDI. FDI is a global organization that supervises oral health worldwide, Federation of Dental International. So it defines oral health as a multifaceted concept, and that it includes ability to speak, smile, smell, taste, touch, chew, swallow, and convey a range of emotions through facial expressions with confidence, without pain, discomfort, and disease of the craniofacial complex. That's a very wide and a all-encompassing definition. Oral health is one of the major things, and we usually say that whatever is going on in the body is being mirrored from the mouth. And the oral health is more than beautiful smile. This diagram shows that it is more of you having all these components all combined together. And that's the reason why when I tell some people that we have up to like 11 specialty in dentistry, they will ask, there's like, in this just this mouth. So all these components have various parts to play when it comes to the issue of oral health. But today, I want to limit it and focus on the periodontal or gum diseases. So permit me to be using interchangeably the gum disease and periodontal.
Okay.
But the gum disease.
Dr. Adewole, can you do the slideshow so you make it bigger? I can see very well, but I think if you do the slideshow, you may, yes.
Okay,
fantastic.
thank you.
People see better. Thank you.
So the periodontal disease or gum disease is a group of inflammatory pathologies that mainly affect the supporting structure of the teeth. These supporting structures, they are basically four. We have the gum itself, that's the gingiva. We have the alveolar bone, we have the periodontal ligament, and the cementum. And two disease entities that form this gum disease are gingivitis and periodontitis. Gingivitis affects 50 to 90% of adult population, and it's often found to be reversible. Whereas the periodontitis is the advanced form. When gingivitis is no longer reversible, you have, and there is loss of attachments at the oral epithelium, you have a non-reversible tissue destruction. called periodontitis. And this affects about 4 to 50% of adult population. Now, there are severe forms of periodontitis, which only affect about close to 10% of adult population. Of course, this is a UK study, but across the globe, across the world generally, it's found to be like in about 10%. So talking about, if you talk about the 10% of population of the whole world is a major thing that we are talking about. Now, I want to move to the fact that gum disease are caused primarily by bacterial plaque. Bacteria, we're all familiar with bacteria, and part of a microorganism that we have in the mouth, that human beings interact with. I can say that bacteria, human beings, we interact with millions of bacteria here and there. And but for this particular disease is caused by some pathogenic ones that affect the host, the individual. And as a result of interaction of the genetic, environmental, and the microbial factors of these bacteria. Now, this diagram does show a kind of a progression from the health to gingivitis, and to periodontitis. Now, the next thing that was just this diagram just talking about a bacterial plaque in a layman. Bacterial plaque or biofilm. When you're talking about film, you are talking of an arrangement of a group of bacteria, all of them living together, protecting themselves, shielding themselves from all sorts of assaults, drugs, and all the like. We have many of them in the mouth, but the key ones that are found to affect gum disease are the ones that are stated here. I must say that the current concept of pathogenesis now is that there is a synergy between all the microorganisms in the mouth, but mostly the bacteria. Now, the risk factors for gum diseases can be divided into two. We have the systemic and the local. The systemic ones are, you have some that are modifiable, that is, we can improve on them. There are some that are non-modifiable. We call them risk determinant. The modifiable ones, modifiable risk factors include the smoking, stress, poor self-care, poorly controlled diabetes mellitus, untreated HIV, oral effect of some medications, obesity, improper diet, chronic inflammation. The local factors are also modifiable, but there are some factors that are not modifiable. Example is we have age, gender, race, genetic disorders, osteoporosis in a adult female or so, normal hormonal variations such as pregnancy. All these are non-modifiable. Now, the local factors are the things that are interplay in the mouth, and they gather enough plaque. They allow the mouth to gather a lot of bacterial plaque that will eventually cause the gum diseases. It includes malocclusion, when the teeth are not well arranged, restoration, when there are some restoration in the mouth, or when the soft tissue, like frenum, is high and is pulling the teeth, when the tooth is rotated or is malpositioned. Orthodontic treatment is also another major local factors. And if there is a trauma within in the mouth, on the teeth, can cause these diseases. Now, pathogenesis, like I said, it's surprising to know that 300 to 400 bacterial species are found in the plaque that is below the gingival margin. I'm not talking of the whole mouth. When you're talking of the whole mouth, but when you are talking of a gingiva, there is there's a gingival margin. Below that gingival margin, there's a sulcus there. It asks about these 400 bacterial species. But the ones that are involved in the pathogenesis are the largely gram-negative bacteria. Now, I want us to look at this framework designed proposed by Kahneman in 1997. It says that there is influence of the bacteria on human hosts, which human hosts will respond by antibodies or polymorphonuclear lymphocytes like neutrophils. And if that continues, you see that body generates some matrix metalloproteinases like collagenases that break down the connective tissue, breaking down the connective tissue and cause some clinical signs of disease and initiation and propagation. But let's look at the upper and the lower factors here. We have the genetic risk factors, and we have the environmental and acquired risk factors. When you talk of environmental factors, are things like diet, smoking, and all this is where they interplay. So if we're going to use this model, maybe, at the control level. Let's quickly look at the clinical feature. What do we see in gum diseases? Number one, patient may complain of pain that is of dull aching, or may have poor oral hygiene, gum swelling, recession of the gum, gum itching or dentin hypersensitivity. You can see this particular picture. You have the gum being swollen, red, and there's a kind of attachment loss here, having gum to recede, the receding of gum. So that is gum gingival recession. Another thing is the issue of the pocket. When the pocket is more than the normal 3 mm, or we have bleeding on probing, there's tooth mobility as a result of loss of supporting structures. The tooth will be mobile, and eventually you have furcation involvement or alveolar bone loss. In this picture now, this probe has gone inside this hole. We call it pockets because it's more than 3 mm in the normal. The normal one is 2 to 3 mm. This other one is this picture shows the malarrangement of teeth. You can see a lot of plaque gathered there because the patient cannot clean the mouth because the teeth are not well arranged. And this is a picture showing furcation involvement. If a patient and loss of bone. Now, the interesting thing about gum disease is that it has been found to link with systemic diseases. We all have all of them here: the cancer, diabetes, advanced pregnancy outcomes, respiratory diseases, and the likes. We are going to look at the possible mechanism that suggests that there is a link how the gum disease are affecting this, or causing, or leading, or is associated with this systemic disease. The first one is the direct mechanism, as I show us on the last slide, whereby the pocket is deep. When it's more than 3 mm and there is loss of attachments at that gingiva, that sulcus, there is going to be a kind of a direct entry point for gum bacteria to enter the systemic circulation. Another one is on the issue of indirect mechanism. Here, we are not talking, we just look for some systemic markers, markers of systemic inflammation, and found them to be increasing as the patient is presenting with gum disease. The example of such marker is a chronic C-reactive protein and interleukin 6, interleukin 1, or TNF alpha, and the like. This one is the third mechanism is one that I like most, or I think is the one that we need to really look at. Gut microbiome dysbiosis. Dysbiosis means that there is an imbalance between the pathogenic organism and the commensal, the one that are protective. So there is the pathogenic imbalance. The pathogenic bacteria are replacing the the protective one, maybe as a result of what the patient is eating or so. So let's just look at some key facts that have been stated in some literature about these links. There's a meta-analysis that showed that individuals with gum disease had 1.14 times higher risk of developing coronary heart disease. A patient with gum disease is 3 times more likely to develop nosocomial pneumonia compared with patients without one. Colorectal carcinoma is the 4th leading cause of death and is being associated with this bacteria here, F nucleatum, and we know that this the Clostridium difficile is the most is the etiologic agent, but it's been found out that this pathologic oral bacteria is being found in such kind of cases. Diabetic patients, you know, the link between the diabetic patient and the periodontitis or gum disease is bidirectional. Diabetes can cause periodontal disease. Periodontal disease can cause diabetes. That one is fully established compared unlike the other ones that are just having association and the likes. I'm going to move. The one that is also very interesting is this adverse pregnancy outcome. Imagine a child, a baby in the womb, a fetus is being affected by the maternal infections by some of the pathogenic organisms in the mouth. So it can come down with low birth weight or stillbirths at some. We have some premature loss, premature rupture of membranes, or even preterm labor. So these are the things that make this topic very, very important. And we need to put some consideration to that. Now, before we go to issue of the control, the prevention, I quickly want to talk about the issue of the diagnosis and periodontal risk assessment. It is important because we have a lot of factors risk factors, but we need to determine the risk factors of each individual because some may have low risk, some have moderate risk, and while some may have high risk. Some things that are used, some parameters that are used there is smoking, diabetes, tooth loss before, age of the patient, when there is a probing depth, and like I said, it's more than 5 mm, for example, is a major thing. Bleeding on probing, when the patient, there's bleeding on probing and other background characteristics. This was developed by Trombelli et al. Trombelli et al. So now the issue of all the things that I've just mentioned, the pocket depth, loss of clinical attachment, all these are accumulated measure of past disease. So they do not provide assessment of the current states of the patient. However, there are still some diagnostic tests that are being used to even predict future disease progression of gum diseases. We have using some of the host inflammatory products and mediator like interleukin-6, C-reactive proteins, tissue breakdown products like this we are very more familiar with here, MMP8 and the subgingival temperature. So we know now that saliva and other oral fluid are very beneficial in risk assessments, diagnostics, and monitoring of treatment outcome of not only gum diseases, even some systemic diseases. So now, the business of the day, why prevention and control are crucial. So we've said that there is because of the emerging link with systemic diseases and their associated economic burden, they need to be prevented. Primary prevention has been wonderful using toothbrushes and other mechanical aids for hundreds of years, but this is not enough. Intervention of gum disease have actually led to reduction of serum glucose, glycated hemoglobin, insulin resistance, fasting blood sugar. All these have been found to reduce even when a patient had treatment of gum diseases. So the various preventive and control strategies I want to look at, the most important one is the plaque control. We know this plaque is the major culprit. We want to control it. Another strategy is the common risk factor approach. This is from the public health perspective. It was designed for cardiovascular disease some time ago. And the important one is the host modulation through diet, lifestyle, and medication. So let's quickly go into them. The plaque control. The plaque control, like I said, that's what the main thing about this about gum disease. It can be self-administered. When you use your toothbrush, you clean by yourself. You floss. These are the self-administered. There are ones that you cannot do by yourself. You can't remove some calculus or some stains in your mouth that you may need to visit a dentist to for some professional care and all surgical procedures that will enhance plaque control. Also, there can be a chemical. We have chemical control. This is usually as adjoint to the main chemical control. The chemical control can be mouth rinses, antibiotics, when indicated, antiseptics. Many of these. It's just that most of the time people tend to abuse some of these chemicals and they end up affecting their oral health. These are the things to use for mechanical plaque control: toothbrushes, dental floss. We have them in various forms. Water irrigation, plaque remover, small interdental brushes. We have them. They are very plenty and all available. Rubber gum stimulator. So the plaque control, which are the adjoints, are we have the toothpaste, a common toothpaste, chlorhexidine gluconate, chlorhexidine gluconate-based mouthwash. There are many mouthwashes out there. But this gluconate is one of the ones that is commonly prescribed. And Listerine, hydrogen peroxide solution. Some of us, like I said, this plaque control, this chemical control just to be used as adjoints with the mechanical control. So these are the plaque control. We have the interdental, we have the dental floss, interdental brushes. These are the wood pick and this wood stick. Okay, these are the various chemical agents or the chemicals that are used in addition to to mechanical control. We have some herbal formulations in toothpaste and some of in these mouth rinses. And the people favor them because of their anti-inflammatory, antibacterial, or antiviral properties. Example: aloe vera, ginger extract, turmeric. Abuses or and turmeric. Abuses or overdosage of these formulations as with serious side effects. So we need to be careful. Composition of toothpaste. I'm not going to go through all of them. We have the water abrasive, fluoride. Fluoride is one of the major components of toothpaste, and some toothpaste don't have fluoride. Thereby, it eventually gives problem to the patients. Flavorant, remineralizer, humectant, anti-sensitivity agent. Composition of toothpaste continue. We have the antibacterial agents there, which is zinc chloride, the detergents, sodium lauryl sulfates, and we have the anticalculous agents. So there are other types of dentifrice. We have the nanotechnology dentifrice, because some people said coconut oil. Well, coconut oil is very good for body generally, but using it as a dentifrice, I don't know. If that doesn't have fluoride, well, it's not really encouraged. The toothpaste, we have some tablets now that they just take into your mouth, and by and large, you are good to go with your brush. So let's just look at just be aware that some plaque advances have been made on plaque control. We have the rechargeable toothbrushes, smart toothbrushes, ultrasonic brushes, ultraviolet sterilized toothbrush system, and like there are plenty. So we should maximize the advantage of a technology. Where for this, some of these, I just see them on the. I've not used some of them, but I know that they are wonderful and they do the job well. Professionally administered care, like I said, it can be non-surgical or surgical. It can be a regenerative. You want to, the lost connective tissue, you want to replace them maybe by use of bone substitute, or you want to even do implant, replacement, restoration of the old tooth itself, and some maintenance, which is one of the major therapy in managing gum diseases. This could be very challenging, you know, is calling patients here and there to come to the clinic. The second approach is the common risk approach, which this diagram depicts it, when you are dealing with, when there is obesity, heart diseases, diabetes, dental caries, periodontal diseases, traumatic dental injury. All these factors somehow link them. Stress linking periodontal disease and heart disease. We have poor hygiene linking to periodontal diseases. We have diets linking to the dental caries. Obesity also leads to heart diseases. So this common risk approach is like, I think it's cheap. You control the whole risk factor affecting the whole body and general health. The last one is on the host modulation strategy. The idea about host modulation strategy is that you upregulate the anti-inflammatory system and downregulate the pro-inflammatory system. The whole thing about host modulation therapy was designed initially for arthritis some decades, about 3 decades ago now, but it's being used now for some periodontal diseases. I must say that the only American Dental Association recommended drug for now as a old modulatory drug is antimicrobial dose, sub-antimicrobial dose doxycycline, usually about 20 milligrams. So it must only be used as adjunct to the scaling and polishing, or scaling and root planing that we usually do for patients. So what are the other host modulating strategies that we have learned, even in this forum so far? The use of prebiotics and probiotics as food supplement, the focusing on the nutrient that we derive from food, the vitamins, vitamin C, not only vitamin C, vitamin E is a major antioxidant, the carotenoid, the omega-3 fatty acid, and all the likes. We have had a kind of a lot of I'm not going to focus on all those ones because we have had some sessions on them. The use of periodontal vaccines, especially for these culprits, P. gingivalis, and this another one, AA. I don't want to, we call it Aggregatibacter actinomycetum comitans. These are major bacteria that have been involved in severe form of periodontitis. So probably in future, periodontal vaccines will be available, will be made, or they are already available, but not widely. I don't see where they are using it on human yet. So what are the prevention tips? Just in summary, brush twice daily. This is very important, preferably after meals. You floss once daily. You know, if you brush twice daily and you don't floss, it's like you wash your glassware, but there's still a part of it that has stain. So it won't be clean 100%. Regular dental checkup at least twice a year or more for high-risk candidate. It can be 3 months, can be 6 months interval. There's need for professional clinic too. Life changes or modification. This is a major key because one of the things that we are dealing with has to do with some life changes. And thanks to Dr. We have some life medicine lifestyle medicine sessions a while ago. Quit smoking. If there is anybody smoking, is a high risk, is a major risk factor for periodontal disease. We have also the issue of stress. This is one of the major culprits. It affects every system of the body. Regular exercises is very, very important. In conclusion, gum diseases are polymicrobial in nature, and its current treatment is centered on the removal or control of plaque by mechanical means with chemical adjuvant. At times, there is a need for surgical procedure. Although the evidence for causative role of gum diseases in systemic diseases is not well established, but its increasing association with these diseases should not be underrated. Prevention and control of gum diseases, whereby shared risk factors such as smoking, diabetes control, dietary and behavioral lifestyles are modified, can only have positive effects on general health and eventually improve the quality of life. These are my references. Thank you for listening.
Thank you so much. That was awesome. Can you pull down the slides, please? Thank you. Whew. I'm sure a lot of things said. I mean, that was a loaded conversation. However, very technical. So we have to break it down. We have to break this down. One thing caught me. You mentioned Treponema denticola. I've never heard that before. I know Treponema pallidum that causes syphilis. And then I'm seeing Treponema denticola. That I have to look up. I need to know more about that. Dr. Jagbe will help me more with that. So I have a question. You told us several times that gum disease, but gum disease causes systemic problems or systemic diseases. What are systemic diseases? If you please tell our audience. Thank you. And how, if you can expatiate on that.
Okay, thank you very much. When you talk of systemic diseases, these are diseases that affect the various systems of the body, starting from the CNS, central nervous system, the cardiovascular system, the respiratory system, gastrointestinal system, musculoskeletal system, renal system. So these are systemic diseases. Now, we are saying that the gum diseases are like in association with them. So, and that's the essence of that links, possible links. In science, we use possible because you cannot really say, you cannot outright 100% say it is this gum disease, because there are other factors that could as well lead to those diseases that we have mentioned. For example, the diabetes mellitus. This is a major chronic systemic disease that affects human being quality of life and all sorts of. So when there's a pocket in a tooth, such that the attachment loss, that pocket is like it's a connector to systemic circulation. So when the bacteria within those pockets get into the circulation, the blood flow to every part of the body, starting from the CNS, first of all, we get to the heart and some other
CNS,
parts
the
of
brain,
the body.
right?
The brain,
CNS,
yes.
the brain, yeah.
Sorry for using some of the medical. I as much as possible try to use plain terminologies so that we all can flow along. These are the systemic diseases. I don't know if you have, for example, in the lung, we have a chronic lung diseases. We are example where we have the bronchitis. We have the emphysema, chronic bronchitis, emphysema. All these, the two make up chronic obstructive pulmonary diseases. We have the asthenia disease, and in the brain we have the stroke, cardiovascular disease of the heart. All these are diseases that affect the system. We are saying that the oral gum disease or oral diseases are a reflection of some of these diseases.
Thank you so much. You know, this is now something that is commonly known. We didn't know this before, that gum disease, issues of the mouth, directly affects the body. Yes, as Dr. Adewole just, reiterated, we've linked diseases of the mouth to heart disease, stroke. They actually cause it. They cause it. So it is very important that we prevent gum disease, that we prevent things, diseases of the mouth that can then result in all these disease entities. There was a slide that Dr. Adewole showed that actually linked to cancer, to all of that. So I'm going to ask Dr. Ajagbe, is raising his hand to ask his question or give his input. Dr. Ajagbe is also a dentist and a professor of dentistry. He was chief at Howard University for 21 years. And he's been a valuable asset to us on Medical Mondays and everywhere this man goes. Thank you so much for what you do, sir. Go ahead.
Hey, Dr. Adewole, welcome.
Thank you, sir.
Thank you for your presentation. Let me just tell the audience, guests, that the topic Dr. Adewole tried to presented on actually is one of the most challenging topics to present at any dental or medical scientific presentations. So you have to pardon him for all of the technical terminologies that he has used, because really there are no layman terms for some of this information that he was trying to pass on. However, just to simplify it for everyone, I always like to make things simple so that everybody can benefit from what we are doing. I mean, we don't want too much information that is not beneficial. So simply, what Dr. Adewole has presented is that gum disease is not separate from the body. So if anything that affects the gum affects the whole body. So it's not like the gum disease is completely separate from the human body. So if there's an infection that affects the gums, there is a way it also affects is connected, because the gum is connected to the whole body. There is a way the diseases from the gum will eventually affect the other parts of the body. So normally, I'm sure there are many Yoruba people on the forum. There are many non-Yoruba speaking people on the forum. I remember when we were young, there used to be a song that was sung to, kind of bring out the detriment of, gum disease and oral diseases generally. It goes something like this: Eyin ru lo kede, when they were rulo kata, baba won lo bogiri, kobe won kole dun. That's a very interesting song. They used to sing it to children so that children can learn to maintain their oral hygiene. Culturally, that part of Nigeria usually use song to emphasize any kind of education. In this case, what we're talking about is what the Yorubas would describe as, when they were ru, which is the gum disease. Enyiru is when you see all these deposits around the teeth and you have rotting cavities. But generally, for everyone who doesn't understand what that is, cavities is when you have decay of the tooth structure. It starts from the white part and it goes to the core of the tooth, and that eventually causes toothache. And many times when the toothache the cavity is not treated, it will end up, the tooth will eventually be lost, either by fracture and it comes out by itself, or it will have to be taken out by a dentist. The gum disease, however, can be caused by so many things, like Dr. Adewole has said. But just to make it simple, bacteria is just the germs that, have the ability to destroy soft tissue. Particularly in gum disease, is the soft tissue that usually is destroyed first, and then it affects the bone. And once the bone is lost so much and the soft tissue is also lost around the teeth, that individual would lose those teeth that are affected. But the topic specifically was trying to connect, the gum disease to systemic disease or general diseases of the body. As you can see, it's not very easy. It's not a straightforward link. However, there are many complex connections. But the most important thing to remember is that if you have a way to control the beginning of any kind of disease around the teeth, then you will not spread any bad diseases to other parts of the body. Yes, it could affect the brain, it could affect the heart, it could affect every system of the body, as Dr. Adewole has explained. But the direct correlation with cardiovascular disease was actually published in 2019.
That is heart disease, right? Cardiovascular
disease. Yes.
Disease.
Cardiovascular disease is heart disease, heart and blood vessel disease. Cardio means heart, vascular means blood vessels. So when we use the word cardiovascular, we are talking about not just the heart, but the blood vessels that are connected to the heart. So the study actually discovered that they discovered that the bacteria that is causing gum disease is actually found in the deposits in the lining of the blood vessels, not just the blood vessels of the heart, but blood vessels everywhere where there is what we call atherosclerosis, which is a disease of the blood vessel where deposits of cholesterol crystals are deposited in the lining of the blood vessels. They found that there are specific bacteria that causes gum disease in that. And that is one of the first direct correlation direct connection between gum diseases and blood vessels. We know definitely that the plaque that is formed in the gums has the bacteria that goes to be part of the plaque that is found in the blood vessels. That means that it's not just by a remote association. It is like there is a direct connection between the two plaques. So the two plaques have to be controlled because that's the central part of the general health that the gum disease affects the most. So The simple thing is this: and the way I would want it to be for you, for every one of our guests, when you go away, is to say to yourself, all right, I have so many teeth in my mouth. I have a role to play to make sure that these teeth last for my lifetime. How do I do that? He has talked about diet. Diet is a very good part of it. So many things. If you don't eat well, eventually it will affect the gums. Will be the first part to be affected. Actually, if you are lacking some vitamins like vitamin C, you start bleeding, abnormally from the gums. If you don't brush, if you don't clean your teeth regularly, definitely is going to cause a problem, not just for the gums, but also for the teeth themselves. You have cavities. If you need to, if you have never seen a dentist before, it's necessary to at least have a checkup to be established that you are healthy, or if there's anything that needs to be, and that it's of concern that you need to attend to quickly, then the dentist can help you. The way I look at cleaning of the teeth is simple, even though Dr. Adewole has put so many options out there. I always ask my patients, what are you trying to clean? Because if you know what you are trying to clean, then it's going to be easy for you to choose what to use to clean that. For instance, if you have a beautiful china that costs so much, would you use sand to clean it? You would not use sand to clean it. Would you use very abrasive sponge to clean a very delicate china? No, you would not. Because you know the value of those, you would try as much as possible not to scratch them. The same thing with our teeth. Our teeth are like the most valuable hard structure and the hardest tissue of the body. So whatever you cannot use to clean your very expensive china, you should not try to use it on your teeth. So if you know the value of your teeth, then you must do everything to protect them. Because if you protect your teeth, you protect your gums, because that's the primary protection for the gums, the teeth. So if you know what you are cleaning is like cheese, a cream cheese on a china, you should not use very abrasive sponge to clean your teeth. If you have something crusty, like leftover fufu on your plate, you should do something to make sure you don't scratch your expensive plate. You must soak it first. And if you don't know how to do that, you need to get somebody to help you in the mouth. So what we are trying to clean is very soft in the first case. If you can clean up the film, what is called the biofilm, which is the same thing as plaque, it is very soft. It's very adherent, but very soft. You can always easily clean it. But if you don't clean it for many days, they will become hard. And that's when they become what the Yoruba is called eyiru. When that tartar is built up around your teeth, you need some help to clean those ones up. So that's basically what you are looking at. You will need to clean your teeth to protect your gums, and your gums, if it's healthy, will protect your teeth. So it's like a symbiotic relationship. Thank you for letting me share.
Thank you. Thank you so very much. Much appreciated. Madam VP had her hand raised, and I don't know. Madam VP? Okay. Auntie Tower, kindly unmute. Kindly unmute. There you go. Great.
Yeah, good evening, Dr. O. Good evening, Dr. Ajabi, and good evening, Dr. Opeyemi, and good evening to the house. Yeah, I'm just wondering, why is our life now so complicated? Our forefathers, they don't do all this, and they live up to 95, though they may have only 4 teeth left. And some of them still have full mouth and they don't do all this and they lead to that. So all this systemic infection talking about is going everywhere. The blood is carrying the system to the nervous system, to the cardiac. Why didn't they die?
Good question. Dr. Opeyemi?
Okay, that's a very fantastic question.
Your video is not on.
Okay, sorry.
Sorry.
Just took like.
There you go.
Okay.
Electricity is out. Hey. So sorry. So sorry. It's all right. Go ahead.
Okay. Thank you, Ma, for that question. What I want to say with respect to, first of all, I mentioned the fact that we interact with a lot of bacteria. And some of all these bacteria, we have millions of bacteria in the body that are protecting us, actually. We call them commensals. They protect the body from diseases. They protect us, they help us fight diseases. But among the bacteria, there are pathologic ones. Now, where did the bacteria come from?
Pathologic ones are disease-causing ones, right?
Yes, the one that cause diseases.
Yeah.
So now, from what we eat, the food we eat, the carbohydrate, the protein, these are the things that give birth to these bacteria. Because initially, the bacteria have been there. We were born with them. They begin to multiply and multiply. But when we begin to change environments, things that we begin to eat, things that we normally, for example, now maybe issue of stress, for example. Stress, normally, if somebody is not stressful, the blood flow easily. But when somebody is stressed, there is a lot of cortisol being produced in your blood. And this will influence or attack or prevent insulin and cause insulin resistance. Like that will cause diabetes, for example. So when you talk about the old people and new generation, one of the various things that is influencing it is more of, we call them environmental factors, behavioral factors. All these things are interplay. They come together to influence the health status of and the most thing that they actually influence are the bacteria, are the immunity. It breaks down the immunity of the body to fight what will have otherwise cause disease. So the body will not be able to get to do what normally is supposed to do on a normal day. That's how short I can just put it. And our lifestyle changes, and like in those people, they use orange chewing stick.
Yeah,
some of them find out that the chewing stick has teeth too. What do you call it? When you chew the stick, they form like a tuft that can easily use, that you can use to clean the mouth. So, but these days, what do we have? We have all sorts of things that people also use to influence their health, whether on the skin or in the mouth, on the lip, all sorts of this. These are the things that changes our disease states. Thank you.
Thank
you so much. That was an excellent question. And you know what? Followed by excellent answer. And it's how our lifestyle has changed.
I know.
It's not the same as our forefathers. Thank you so much, Dr. Adewole, for reminding us of chewing stick.
Mm-hmm.
There are different kinds of chewing stick. There are some that, even when you use them, they give this peppery, feeling in the mouth, which kills bacteria. But beyond that, our forefathers did not eat the kinds of sugars that we eat. And those are not good for the teeth. It's just lifestyle has changed. And the stress level too has changed. We walk around the clock. Dr. Adewole is up now it started at 1 a.m. 7 p.m. here is 1 a.m. in Nigeria. This young doctor does not miss Medical Mondays. And I meet him also on other platforms that are educational, that are important. And he knows, and he works during the day. Yes, I clap for him too, thank you. He works during the day. See, our forefathers did not do that. So that's why. And research also. A lot of researches are going on. We're learning more and more every day. And so now with research, we're able to connect gum disease with diseases of the body. Does that make sense? Does it make sense, Dr. Adewole?
Yes, you're on point, man.
You know, you guys are so brilliant. You kick my behind and you just speak those big grammatical, scientific words. So I have to get your back and help you break it down.
Thank you.
So
thank you.
You're welcome. You're welcome. Thank you. Mr. Adenekon, Uncle Latif Adenekon, please unmute yourself and ask your question. There you go. Welcome, sir.
Thank you very much. You really make my day today because for some few months, I lost maintaining myself from what you are saying. I used to be very, very active because I was told teeth is very important. But I want to ask you a good question. There is two types of what do you call it? Things that you use to brush your teeth. One is for gum, and the other one is irregular periodontitis that you use. And how often do you use the one for gum on a daily basis? And how often do you use the one for the regular one that you use to brush? Then secondly, do you floss every time after your meal? Which is better, please? That's what I want to ask.
Dr. Adewole.
Okay. Thank you, sir, for that question. That's the first one. The first question I didn't get it very well with times of you brush. I need that question to be framed. But the issue of when should we floss? Now, you can floss before your tooth brushing. Now, the idea is there are some places that your toothbrush will not get to in between teeth. These places are not easily, the brush cannot access those embrasures, those areas. So that's the reason why you floss. And it is recommended that one should floss once daily, in addition to whether you want to do it in the morning, you want to do it through in the day, or you want to do it in the night. Depends. So long you brush, there will still be some particles that hide inside those in between teeth. Those places we may not see it physically, but they are there. When you use those floss, those it will bring out those soft particles or bacteria that are hiding inside those things. The idea about the brushing or flossing is that you want to reduce the concentration of those bacteria or those plaque. Yes, if you look at your mouth now, if we look at our mouth now, we will see that there's still a portion of plaque, or you cannot eliminate all of them at once, but want to reduce them to minimal level that they won't cause any disease. I don't know if I've answered that question, sir.
Yes, you do. Thank you very much. I appreciate you.
The other one about the brushing, sir, the gum, brushing gum, can you reframe it, sir?
No, there's a, what do you call it? This gum they sell this gum peroxide. I say it's good for gum, and the regular one that you use
Hydrogen
for
peroxide?
yes, yes,
Gum
they sell it.
peroxide.
Right. So
Okay.
when do you use that one? Do you use it also on a daily basis, or do you use it once a day and the other ones twice a day?
Okay. Well, if I know there are some hydrogen peroxide preparations that are being made. The thing about hydrogen peroxide is that hydrogen peroxide as a substance is very good because it releases oxygen. You know, these oxygen are very toxic for this bacteria that we are talking about. So when you use hydrogen peroxide, it will go after this bacteria. Yes, that's fine. But you know, the problem is that by the time people are using it over and over and over, it's not going to attack. After you have eliminated all the bacteria, it will be going after the normal ones that are supposed to be protecting. So that's the one thing about the issue of using hydrogen peroxide or any mouth rinse. I will suggest that mouth rinse should be minimally, you should not overuse mouth rinse because it's like you are taking antibiotics from time to time. Definitely, we come to time that there will be an antibacterial resistance to the body. So that's that. So you use it as moderately as possible, not something that you should use for a long time. You use it maybe 1 day, 2 days. After that, maybe in another 2 weeks, or you don't have to use it. But if you do brushing and flossing effectively, it should take care of our oral control gum diseases. Thank you, sir.
Thank you very much. Thank you.
Thank you. You know, your question reminds me of an incident in medical school. One of my colleagues said it didn't make sense that we floss at night, that we need to floss before we brush in the morning. And so we all switched to flossing in the morning before we brushed. And in later years, think about it. I'm sure my colleagues too have found out that, you know, when you sleep, the bacteria in your mouth, you know, kind of sort of colonizes the mouth and, you know, can cause, you know, all the havocs that they cause. So if we can brush before we sleep, floss all those food that we've eaten during the day, and then, you know, brush before we sleep, if we don't eliminate all this, you know, toxic bacteria, we will reduce them significantly. And so they will not colonize the mouth, which is why, you know, when you wake up in the morning, if you didn't brush, you have morning breath because of the bacteria that has been, you know, having a field day in the mouth overnight. And so it was important, it's still important that we floss and brush at night before we sleep. But I just thought, as you guys were discussing this, I remembered, you know, how we did when I was in medical school, and I started laughing. Like, you know, you grow, we continue to learn, and research continues to, you know, show us the right way to go. So some people also, depending on your teeth configuration, Dr. Adewole showed us, you know, different types. Then you notice that when you eat any time of the day, you may have food stuck in between your teeth. Then you can floss to take them out so you don't allow them to stay in there for long enough to cause havoc. So Dr. Ajagbe, you have your hand raised again. You can unmute, sir.
Yeah, thank you for the questions. And Dr. Adewole, excellent responses.
Thank you, sir.
The first thing I wanted to make comment about is about the difference in the disease incidences in the past compared to the present. One of the things you have to remember is our forefathers in Africa, they depended on plants for most parts. And so they have all kinds of plants they have access to. The commonest ones that you don't even realize how valuable they are bitter leaf. Bitter leaf tree or stem has so many chemicals that are antibacterial. So many leaves have antibacterial, antiviral, and antifungal properties, and they chew on this on a regular basis. And these are some of the ways by which they balance the bacteria and the microorganisms in their mouths, which in effect actually protects them from the rampant effect of the gum disease. Now, it doesn't mean that they never had gum diseases. That's not the situation. They did have gum diseases, but because of the kind of fibrous food they were eating, they had simultaneous mechanical cleansing of their teeth. For instance, somebody who chews on sugar cane on a regular basis. Sugar cane has sucrose in the juice. However, the fiber in the sugar cane, as they chew on it, actually presents some protective, effect on the teeth as well as on the gums. When you chew sugar cane, for instance, or you chew any of those sticks that our forefathers used to chew on, there is no way plaque will have room to build up because you have continuous salivary flow. Now, many times you can sit at a desk right now that you don't even talk to anybody, depending on the kind of job you do. And when you don't talk and there isn't much salivary flow, the plaque will form. And that is part of the steps of pathogenesis, as Dr. Adewole was talking about. If there is no salivary flow, definitely you will have increased plaque formation. Increased plaque formation will increase cavity formation as well as gum disease. That is one aspect that I would like to allude to. Then the other aspect that Dr. Adewole mentioned, hydrogen peroxide. Well, there is an ongoing understanding about this. The truth is, hydrogen peroxide is one of the cheapest and the most valuable products in the market. The producers of toothpaste and expensive devices do not want that to be the case, because if everybody uses hydrogen peroxide and is very effective, who is going to use the toothpaste? Who is going to use the ultrasonic toothbrushes? It will just be fashionable that, oh yeah, a status symbol. I'm very rich. I can't use chewing stick. I will use ultrasonic toothbrush because I can afford it. It's $1,000. Yeah, I like it. I got it for a Christmas gift and stuff like that. No, hydrogen peroxide is not as dangerous as it sounds. I use hydrogen peroxide on a regular basis. There is no adverse effect whatsoever from hydrogen peroxide. If you don't use a very strong concentration. And I've told hundreds of my patients the same. When they've had difficulty in controlling their gum diseases, after coming to the dental office, after prescribing chlorhexidine, that we call Peridex, they still have problems. And until I give them simple instruction of using baking soda and hydrogen peroxide on a regular basis, their gum disease were not controlled. So yes, theoretically, what Dr. Adewole was saying is possible that hydrogen peroxide, any anaerobic organism, will be killed by the hydrogen peroxide. And most of the commensals are not anaerobic. Most of the commensals are aerobic. They enjoy being in oxygen. So if the target for hydrogen peroxide are the anaerobic ones. Anaerobic ones are the ones that cannot survive in the presence of oxygen. So that is the target. Those are the ones that are causing diseases all over the body. It's not only in the mouth. They cause diseases everywhere. If you have a wound, an ulcer that doesn't heal, and it stinks, and it's smelly, and it has greenish stuff on it, it is because it has the anaerobic organisms. Those are the ones that cannot survive in the presence of oxygen. When you use hydrogen peroxide on such wounds, very soon it will dissolve. It will heal. Gradually it will heal. Hydrogen peroxide is very important. Baking soda is equally important because baking soda is alkaline. That is, it neutralizes the acid that is being released by the bacteria that are causing this problem in our mouths. So you use baking soda to neutralize the acid, which will dissolve the tooth, and you use hydrogen peroxide to destroy the anaerobic organisms that destroy the gums. So I think a combination of those. In fact, some manufacturers are capitalizing on that. They are beginning to bring out peroxide toothpaste with baking soda. Arm & Hammer is one. If you want to research that, you will see it. And there are other products that are also there that combine hydrogen peroxide in one barrel and the baking soda in another barrel. When you inject, when you press them out, they mix together and they form a complex tooth dentifrice. The toothpaste that contains both hydrogen peroxide and baking soda. So I will not totally eliminate the use. If you do have very bad breath, whether you brush 10 times a day and your breath is still funky, you need baking soda and hydrogen peroxide. That will eliminate all your bad breath in a heartbeat. Even though researches will not be done on some of these things because they do not generate revenue for the people that support researches, they're still nonetheless very effective. Many people are still using chewing sticks. I know definitely some people cannot finish their home care without chewing stick first before they use toothbrush. Whether you use chewing stick and toothbrush, just know what you are cleaning. If you can clean what you are cleaning with just the chewing stick, you don't need any toothbrush. You don't need any additional toothpaste. But if you have diseases already, that is, your gum is already rotten, you have very bad breath, you need help. And anything that the dentist prescribes to you, if it doesn't help, then you go back and say, sorry, what you prescribed didn't help. There are other alternatives.
Thank you so very much. There's a comment here that's also piggyback on Dr. Adewole and Dr. Ajagbe. Mr. Goega Emmanuel said, on Auntie Tawa's question, I wish to observe that we don't always have adequate information on the population of our old folks that have died or put up with avoidable diseases associated with gum and dental issues. Let's remember that mortality and morbidity records in some parts of the world are wildly recent. In effect, for every person that lived up to 95, we don't know the number that are falling by the way. And I think it's right on the money. And he added, once again, this has been a great outing. Well, I'm going to leave that for later. Rosemary, kindly, Sister Rosemary, kindly unmute. Thank you, and ask your question.
Good evening, Dr.
Sister Rosemary is a counselor. Good evening.
And Dr. Ajagbe, thank you very much, Dr. Toyin. I just want to add something because my mom told me about a family that had tooth problem in Nigeria, and what they used curing it was their urine. So how about that? In Africa, in the village. So they use their urine to cure their toothache and the tooth infection. So I just want, I don't know if you know about it, Dr. Ajagbe or Dr. Opeyemi.
Okay.
Ew. Ew.
That's quite funny.
Ew.
I know. According to her, it said, it worked. So I don't know, how.
What I will say with respect to that is that, we human beings, we like to explore. We explore things. But at times is the mindset or belief that people had on certain things. It's not really that there is no scientific proof that using urine will cure gum disease. But those things, people can use anything in their mouth, but that is not scientifically, we cannot, there's no evidence of using urine. Urine is passed out, is something that you're supposed to, it's out. There's no,
it's a waste product. How can you put
how do you want to put the waste products inside the body again and to use it to clean? I don't know.
I'm sorry, that is very gross.
All right, may I say something real quick?
Yes, sir.
You cannot discredit their claim, though. The fact that they observed it and somebody shared it with you shows that there was an effectiveness. Actually, I'm looking at an article right now, the Journal of Clinical Investigation, that actually addresses the antibacterial activity of human urine. I'm not going to go into the details of that, but I'm not saying that they cleared it for use in the mouth. But I can tell you this for a fact. When we were young, I was in elementary school on the campus of University of Ibadan, Aberdeen School. Interestingly, every time we went, pretty much like we were asked to do some after school events and somebody bumped their toe on a rock. I mean, there are many, stock rock in the ground when you walk where there's no tar or grass. As soon as a person bumped the toe and is bleeding, they will call everybody around to come and please to pee on their toe. I don't know where that idea came from.
Yeah, because there's some acid or whatever there, but to put urine back in your mouth, man.
Excuse me, let me just finish real quick. So you can imagine that intuitively, somehow some people had this idea that the urine has something. They don't know the science. They don't know anything about it. I did it before, but I didn't know what it was as a child. Now, somebody might have taken that idea and say, well, this toothache, that we don't have any medicine to cure this toothache. Why don't we try the urine? Well, they tried it and it worked for that person. Well, that's something very, very graphic to some of us and gross. However, it did the job. Yeah. I also remember that not human urine, but the urine of cows have been used for so many things in the African culture. So many have used it for so-called epilepsy, for instance. I don't know what chemical was present in the cow urine that anybody would see was useful for epilepsy, for instance. But since we don't do research we don't constantly do such research to question or to validate some of these claims, we have to just take them as anecdotes. They're anecdotal, and that's the classification we can give to them at this point until somebody proves it. in the kind of article that I was referring to, which you can search for yourself, because there's ammonia in the urine, and there are some other chemicals that are being excreted because they are excessive in our body or they're byproducts of metabolism, they may have antibacterial effect that we have not evaluated. And that is part of the claims in this article that I was just referring to. This was published in the Journal of Clinical Investigation. So I think it is open to
research.
It's open to research. Dr. Adewole, I think it's something. I think, Dr. Adewole, you are in research. I think that is something that is challenging your knowledge right now that you need to investigate. Urine is in abundance. There are many factors to look at for seriously. And in fact, when that comment was made, that was why I went back to the literature, and I think I had seen that before. And I remember what I did when I was a child, peeing on somebody's stove.
Dr. Ajagbe, okay. So this is the deal. Research needs to be done on this.
Yes.
But this we would have to discuss further in the future, because I'm wondering, when you do this research, is somebody going to be, rinsing their mouth with their own urine or somebody else's urine? We won't answer that question right now. We will leave it alone.
Their own urine.
So we can stay on point, but we have a lot of discussion to do.
And can I say something, please?
Please.
Yeah. There was somebody that I saw, out there on the street, a friend of mine, and they had a swollen mouth. And I told him about what my mom told me. He did it. And guess what? That's in STAP. So
exactly. That's the point. We have to do research, but discussion, we have to discuss. Is it my urine I'm going to be rinsing my mouth with, or I'm going to be rinsing my mouth with your urine? It's my urine. It won't be Dr. Adewole's urine. Just that's open to discussion. We'll discuss it later, but not on this, not tonight, so that we can focus on the issues at hand. Auntie Susanna, I'm asking you to unmute so that you can ask your question. Go ahead, ma'am.
I'm sorry, that was a mistake.
It was a mistake? Okay.
Yes.
Then Auntie Tower, go ahead, ma'am.
Well, most of the thing I wanted to talk about has already been discussed. In the urine, there's ammonia. And here, somebody has epilepsy, you always have this ammonia little thing that is around their room. That in case they started having the seizure, you break it and put it in their nose, and it's ammonia. So I think it's the ammonia in the urine that is doing the job.
Okay. Thank you. We have to research that. I said it. For us, until it is researched and research supports it, it's still a theory. Yeah. So we will discuss that. Thank you so much, though, for that input. Dr. Booker, Sister Moore, my darling sister.
Thank you. This was very interesting. And I learned about this topic at an NMA forum, where they said, if your mouth is not good or is not clean, your body is not. So we know a lot of the endocarditis is from diseases in the mouth. But I want, on the fact of urine, one comment. 1 in 10 dilution is a good thing, is a good fertilizer for your soil. I learned that in Nigeria. Second, for the orchids to grow, 1 in 10 dilution of urine.
Wow.
So that is, and I've seen it work on the plants. But the one thing I wanted to find out, has any research been done on chewing stick to find out what is in the chewing stick? And in Guyana, we use something called black sage. Some people never use toothbrushes, but they use that to clean their teeth. Secondly, what about salt water? The use of, I still use salt water when I'm brushing sometimes. And I do use hydrogen peroxide. There's a spray you could get. So I spray it in my mouth and rinse. It comes in a spray at CVS. I think that's about it. Yeah, I just wondered about salt water. Can we continue to gargle salt water to brush with it? Thank you.
Thank you. You know, I believe Dr. Buka, she's an anesthesiologist and she doesn't say what she does not know. So I got that for fertilizer. I'm excited because, you know, my hydroponics is going on here and I'm ready to transplant my plants, some of them when the summer rolls around. So, Dr. Adewole, what about salt water?
Well, thank you very much for that question. The issue of salt water is one of the things that we actually recommend. But this time around, we call it warm saline mouth bath. Now, the idea is the salts, you know, salts, high concentration of salts is very toxic to any germ or whatever. The kind of that water, it has to be boiled. Boiled in the sense that you have sterilized it and make sure that all the germ has been killed. But this time around, you allow it to cool down a little bit and get a teaspoon and get a scoop of salts and level it, not the full scoop, just level it and put it inside that water and use it to gargle, you know, around your mouth. The idea is that the heat will cause vasodilation, allow more blood flow in the mouth, and the salty concentration is toxic for any bacteria or whatever, so they can't be in that kind of environment. And the water, the cleansing effect of water tends to just wash them away. So using of salt water is good, but it has to be modified. It's not just the whole, so just put all sort of get a spoon of salt and put it inside a small, no. Leveled salt into a cup of warm water. Stir it. When the temperature is what the mouth can tolerate, you can test that on your skin, so you know that, okay, my mouth can tolerate this. Use it to any area of the mouth that is having maybe gum disease, or if you go there and do magic. So now salt is good for the body.
Thank you. Thank you. So I have some questions here, and I may need to call on the writer. What is the strength of the hydrogen peroxide? And there's a follow-up question. There is a controversy in the use of fluoride products, fluoride and lots toxicity to body tissue.
Okay, let me make a comment on that, if I may. The hydrogen peroxide, the concentration that is safe is 3%. If 3% seems to be too strong for you, just dilute it 50-50 with water and you'll be fine. Anytime you have hydrogen peroxide that doesn't create foaming effects on any organic tissue, it means it's not strong enough to do anything. The foaming effect of hydrogen peroxide is what causes the release of oxygen. That release of oxygen is what is very important in controlling the oxygen-hating bacteria that cause diseases all over the body. All right. So the second comment, what was that? The second question again?
That there is a controversy in the use of fluoride products.
Oh, yeah.
That is fluoride and lots.
Oh, yeah.
Lots of toxicity to the body tissue.
Yes, there is a movement, and usually the movement starts in the US. About similar to what happened with the amalgam, the mercury in the mouth from the fillings. There are some people that are all over the place complaining about the toxicity of fluoride to other organs of the body. Yeah, there are specific research publications that point in that direction. But everything has to do with moderation and the minimal inhibitory effect of fluoride is what must be judged. It's true that high doses of fluoride can cause problems, not just in the organs, but in the teeth of children that are yet to form, like a little child that is always sucking on toothpaste, for instance, that has a very high dose of fluoride will end up having their adult teeth mottled, or what we call fluorosis. If you've seen some people from different parts of the world, like from Kenya, from Zambia, from East Africa, for instance, where they have very high fluoride content in their water, more than 100 parts per million, they do have what we call generalized mottling of their teeth, which is fluorosis. The advantage of those people that have fluorosis is that they do not get cavities. Their enamel are so tough that no acid from any bacteria will dissolve those teeth. Their teeth might be ugly, they might be very brown, very deep orange in color, but the teeth are tough as hell against bacteria. So there is an advantage in teeth when fluoride is if you have the normal concentration of fluoride in formed teeth, the teeth will be resistant to bacterial dissolution, which is what we call cavitation. Cavity formation is the reason why they put the fluoride in the water that we drink in the first case. And they now said, well, for children, let's add more to the toothpaste so that when they brush their teeth, even their baby teeth will be protected from cavity and so on. But we know if everything is done to moderation, there will not be any overall general side effects in the body.
Thank you so much, sir. Thank you. So there's another question. Go ahead. Dr. Adewole.
I just want to add, with respect to the concentration of fluoride, for example, adult requirement of fluoride in toothpaste is different from that of children. Anything that is like 1,450 parts per million, that's the concentration for adult. But for the children, the children, like 550 parts per million. So anything that is above that may tend to cause eye or fluoride toxicity. Most of the time, children at times can even swallow some of fluoride, this toothpaste while they are brushing their teeth. Yes. So, but like Prof just said, moderation is what is important in dealing with fluoride, not too much or overuse. Thank you.
Thank you. In fact, with everything, we have to do things in moderation. I agree. So there's another question. Is there in existence in the regenerative realm the ability of regenerating bone loss?
Is there
in existence presently in the regenerative realm the ability of regenerating bone loss? Like bone loss in the teeth.
Yes.
Is there ability of regenerating it? Because what we know right now is implantation. You can actually, just implant a new tooth that looks just like yours. But is there regeneration? Can bone loss be regenerated? Is what the question is saying.
Thank you very much for that question. That's a very fantastic question. As of today, I can boldly, I want to say that dentists are not just cleaning teeth. There are other things like restoration. And I can tell you boldly, even if I'm not in the issue of accessibility to some of these materials are not readily available, but we still use them. There are there are generative, there are a lot of methods whereby tissues like bone are being generated. We call them tissue regenerative, tissue engineering or regeneration. So I mentioned the issue of use of bone substitutes. You can use bone substitute to generate, to regenerate bone, not only bone, even some of the supporting structures that surround the teeth. So there are plenty of them. There are plenty use of bioglass. There are a lot of substances, materials that are being used to regenerate the lost part of teeth, of supporting structure of teeth that are that may be lost as a result of gum diseases.
Thank you. That is fascinating. I find that fascinating. Dr. William Craig is the one asking all of these questions, and he still has another one. It made a point that a case was found where the heart valves were impacted by the same bacteria found in the mouth. I think, that has been addressed and discussed by both of you. And I think this was posted, earlier on. He also asked, though, that how relative is a low D status to healthy oral bone? Dr. Craig, can you ask that one? Are you asking about vitamin D status?
I am indeed asking about vitamin D. So many of us have a low D status right now. And I'm curious if there is a relationship between bone loss in terms of mouth and low vitamin D status right now. I know age might be a factor to that, which I think is still under research. But, so many elders do lose a certain amount of bone over years, and we also are low D. Maybe Dr. Ajibay or Dr. Adewole could speak to that. I don't know.
Yeah, let me say something about that real quick. Dr. Adewole, you may add some. Vitamin D is very important in bone metabolism, definitely. We know that as a basic understanding when we're training. And yes, there's a very high prevalence of low vitamin D in the population. Yes, primarily if the bone metabolism is abnormal because of severe a deficiency of vitamin D, just like vitamin C, the first tissue to be attacked will be the tissues in the mouth, more so around the teeth. So if vitamin D is low, it affects the delicate bone that surrounds the teeth. The same way the vitamin C will damage the deficiency of vitamin C will attack the gum tissue. So imagine having both. If you have vitamin C deficiency and vitamin D deficiency, the chance of losing your teeth prematurely is very high. Okay, so the issue of replacement of tissue loss. There are many new techniques that are being published on a regular basis. Many of them require, bioengineering, which means they grow tissue in the lab and they become compatible, with human body, that human body doesn't reject them, not just in terms of the tooth structure, like the implants, but even the soft tissues now are being grown in the labs. That because when for implant surgery, I've used the synthetic collagen membranes to actually simulate gum tissue foundation in where the gum tissue will grow around the implants over time. So there are many ways. Yes, I've used synthetic bone as well as cadaveric bone to help augment, the jaw bones around the implants. So there are ways by which we can stimulate new bone growth. They're not always as stable as we want them to be because the original the foundational problem has to be addressed first. So for most of the time, we'd never send patients to go and do a vitamin C or vitamin D lab evaluation before the surgery is done. So if that was the problem, when you do all of these expensive procedures, they may not be successful. So your question is very valid. If we don't know about the status of the vitamins in the body, all these major surgeries will just be exercise in futility.
Thank you.
Thank you. Dr. Adewole, do you have any comments on that?
Thank you, sir.
I just wanted to say that we have lots of questions in the chat box, and if we can, I want us to be able to answer.
Yes, there's a question that I saw that with respect to
they'll be asked.
Okay, now with respect to the issue of the vitamin D, I like what Prof has just said. Vitamin D is very, very important. One of the major vitamins in the body that is very, very important. In fact, for regulation of calcium, whether in youth, in a young, or in adults, vitamin D is very important. And also in the immune system, it plays a major role in some people are linking issue of a vitamin D deficiency to cancer now, because vitamin D has anti-carcinogenic property. And it's issue of the immune system. Let's talk even the immune system. Let's just limit it at immune system. So calcium metabolism and immune system, if the vitamin D that regulates them is low, definitely it's going to affect. It's going to affect not only the teeth, it's going to affect the gum. It's going to affect the gum. If we leave that, it will affect all other systems or system of the body. So vitamin D is very, very important. And of course, the assessments, we really do them, but we know that from various, there are various ways that people can get vitamin D, whether exposure to sun or taking it as supplement, many ways. These are the things I want to add with respect.
Thank you so much. Thank you for the vitamin D question. Just to remind us, we've done this on Medical Mondays a few times. Deficiency of vitamin D can lead to high blood pressure, multiple sclerosis, osteoporosis, which is a bone disease that makes the bone brittle, that it can break easily without somebody having, trauma or falling or anything like that. Vitamin D deficiency can cause low back pain, constipation. It's been linked to colon cancer, dementia, and depression. Research is still going on vitamin D. And so it's important that, we all get our levels checked and, make sure that we have good levels. Getting vitamin D from the sun for people like us, Black people, we have melanin. We have melanin, and that shields us from the sun. So if you're going to expose yourself to the sun, maybe the early morning sun for, 30 minutes, 45 minutes, you may be able to get some, but supplementation is good. And milk is not a substitute for vitamin D. You don't get enough vitamin D in milk. You cannot, go look at the content. the ingredients. So if you need supplementation, get the vitamin D supplement. So Honorable Gustav.
Thank you so much. And you can watch previous editions of Medical Monday where we discuss vitamin D on the YouTube channel, Medical Mondays with Dr. O. To the questions, and the Dr. Ajay says, who is most at risk of periodontal disease?
Okay. With respect to the risk of periodontal disease, there are, like I mentioned, there are many risk factors that can lead to them. But I pinpointed some key factors. Number one, anyone that has diabetes mellitus or any systemic disease that compromises the immune system. That's number one. Number two, somebody that has pockets that it's more than 5 mm. Pockets, that thing between the gum and the tooth, that's pockets. So the deeper it's getting to, the higher the risk of the person getting higher form of periodontitis. Another one is the issue, somebody that is having some bleeding on probing. Maybe when you are examining, or the patient is brushing the teeth and blood is coming out. It means he's getting some of all these bacteria in accumulation. Another point is on the issue of the people that have lost teeth before. Some people, their oral hygiene is very okay, but they notice that their teeth are mobile, are shaking. These people have higher risk of gum diseases. Another one is on the issue of I mentioned the issue of attachment loss. When somebody, whether it's by virtue of a habit, you are brushing too hard, you are making the gum to recede. So the person is bringing himself to higher risk of coming down with periodontitis. The other thing is on the issue of genetics. Maybe in the family, there are some like aggressive forms usually happens in families. They just notice that the siblings have all sorts of teeth being lost teeth before the person is getting to adult age. Thank you.
Thank you so much, Dr. Opeyemi. Dr. Abija wants to know. There's the question. Thank you, Dr. Opeyemi, for the insightful education about gum disease prevention. I appreciate the fact that you mentioned lifestyle modification, which you said is key. Do you have any dietary recommendation that can help halt gum erosion in addition to following the common dental hygiene regimen? Not sure if this assertion is true about eating chewy foods can strengthen the gum and build more enamel to replace the bone loss.
Okay, all right. Thank you, Dr. Abija, for that question. On this platform, on this forum, there have been a lot of dietary recommendations, and that's why I didn't want to, because we already have quite a sessions on it. But let me just quickly say that lifestyle is the key, because some of the things that we are controlling are actually within our reach. It's something that we have to do. For example, brushing of teeth. You are going to brush twice daily. Is you. The flossing is you. So the dietary comment, the issue of avoiding stress, avoiding all sort of is something that you have to develop as a lifestyle. So bringing it to the fact that, and when we incorporate this, it affects, control, and bring our health in shape. The dietary recommendation, there are no special dietary modification apart from the ones that we have been talking about. So, and chewing of of hard food, especially for children, have been found to develop their jaw, which eventually will develop their oral health. So it's just to follow the normal, the food, each of the vitamins, vitamin A, all the vitamins as much as possible, go for antioxidants, go for vegetables, go for fruits, all these things, put them in moderation, and all sort of, it just eats balanced diets. I think that one will suffice for that. Thank you.
I just want to quickly interject. So chewing, like chewing the bone of chicken, bone of fish. What do you say to that? Because people say in Africa that when you chew those things, they strengthen your teeth. Is that true?
Yes. The chewing, mastication, actually, Professor Adewole has presented something about that in time past. The chewing develops the jaw and makes the teeth to align properly. So if a growing child is not taking something, is taking soft-based diet, definitely he may end up having a kind of a small jaw, because the muscle, the activity of the muscle tends to increase the jaw development. It makes the jaw to expand in a way, and so allow the teeth to align in their positions correctly. So eating, even chewing, really, it increases your saliva production. And saliva full of all sorts of anti-immune substances that support immune system, hemoglobin A, and all sorts of glycoproteins for cleansing action. So it's very important. Chewing is very, very important in oral health, because the more you produce the saliva, the more cleansing action you have, and the less accumulation of bacteria. Have you noticed that any side of the mouth that you are chewing with, that place tends to be cleaner compared to the other side that you don't chew with? That's just a simple illustration for that. Thank you.
Great job, Dr. Adewole. Yomi Lawa wants to know if there is any adverse effect to using wooden toothpick in particular instead of flossing.
Yes, there are some wooden sticks that are designed. Actually, the cross section of the tip has shown that there is a limit that stick can go. But there are some toothpicks that after you finish eating, some can go as low as taking pin. They just insert it because it's very soothing. And when you put it into that area, it tends to has a soothing effect. And so when you use a wooden stick, it can't go to there is a level that it cannot get beyond. So it's still okay. But the flossing also has its own advantage because of the wax. Some of them have wax, so it can easily move around the tooth surface without injuring the gum. So that's just the difference. Thank you.
Thank you so much. Excellent presentation, Dr. Adewole. How effective are the African traditional teeth cleaning methods like chewing sticks, plants, etc., in preventing gum diseases?
Well, I'm not going to condemn our traditional chewing sticks. They have been used for hundreds of years and they have been effective. In fact, there are some chewing sticks that have some antibacterial properties that have not even been researched. Yeah, you have heard of Oriental, all sort of mango. You have some of them here in Nigeria. There are plenty. So
Oriental is chewing stick with pepper.
So they are, you know, when you think of a toothpaste now that has peppermint flavor, you know, it's just a way of extracting that oriata, that pepper inside that chewing stick and incorporate it into toothpaste. So those things actually, so long they form the tufts, smooth tuft, they can clean, they are effective, but you know, they cannot, by virtue of technology and advance in knowledge, we get to know that there are increasing knowledge, you know, something that science is beneficial to us. So we cannot we improve on what some of all those things, or improve on the advantages of some of all those chewing stick. But I will not want to go to the age of chewing stick now as an individual, because I know that there are many easy. I'm not going to go and look for Oriata when I already know I can easily get toothpaste that, of course, economically you are giving money away, but I think that's just the idea. Thank you.
Thank you. Sister Lola joined the discussion on mouthwash. She said that's interesting about mouthwash. I've actually been advised by my dentist to rinse daily with mouthwash after brushing. And then Kehende says, I use baking soda from time to time. I would just like to say we have to watch the salt content as it is sodium bicarbonate. It can raise BP if frequently used. I use hydrogen peroxide and totally agree with its effectiveness mentioned on this platform. Any comment on that?
Yes, that's in order, but moderation is the key. Moderation and moderation is the key. Don't use excessive. Don't use these things in excessive or in abuse. Anything in life that we use in overuse, most likely it tends to have some negative side effects. Even if it's laughter is good. If you laugh too much, you can have some TMJ issue. So anything, that's just the moderation is what I want to emphasize there. Like we have mentioned before, those mouthwashes are good, but if you have used it and they have cured you don't have the gum disease, I think you should wait for some time before you use them, especially the one that actually contain antibacterial. Antibacterial overuse can cause resistance of the bacteria to those resistance of those bacteria. Thank you.
Okay. There's a question from Lola. Say, how do we use them, Dr. Jagbe? Make a paste out of baking soda and hydrogen peroxide. I think she's referring to when Dr. Jagbe spoke about baking soda and hydrogen peroxide. Dr. Jagbe, if you're there.
Well, I'm here. Well, the dialogue continues. You can make a slurry of a mixture of hydrogen peroxide and baking soda simply by wetting your toothbrush first with hydrogen peroxide and picking a chunk of baking soda with that. Before the baking soda dissolves in your saliva, it's slightly abrasive, but not very harsh. As soon as you start brushing with hydrogen peroxide and baking soda, it will foam in your mouth like you are using regular toothpaste. And that's a very good effect. The hydrogen peroxide, as it forms, will release the oxygen that is necessary to destroy the anaerobic organisms. The baking soda dissolves in your saliva to release the alkaline effect to neutralize any acid released by the bacteria in the plaque. So you need both. You need both to truly do a very good job. When you do this, you do not swallow your spit. You have to spit out and rinse your mouth. So you only have less than 3 minutes exposure to these products. So you are not keeping it in your mouth for 10 hours in a day. No. You use it for only a few minutes. At the most, you are spending 5 minutes to brush your teeth. That's if you are extraordinary in terms of being meticulous. Otherwise, in less than 2-3 minutes, you are done with brushing. So easily just move your tongue around and see that all the surfaces that you used to feel rough are now very smooth and polished after each brushing. That's how effective you know that your brushing or anything you are using to clean your teeth has been. So do not swallow the baking soda. Do not swallow the hydrogen peroxide. If you don't swallow them, they're not going to get absorbed into your bloodstream to cause any generalized side effects. One thing I wanted to add is I raised my hand for a while, but I guess I'll be called later on. But what I was raising my hand to say is that there's another factor that has not been addressed, and that is the factor of clenching or grinding the teeth.
So we wanted to do that another.
No, I just want to add that to say that it's one of the factors to to having gum disease. What we call traumatic occlusion can cause the loss of tissues around the teeth as well.
Thank you so much. An interesting question from Tony. After brushing your teeth with toothpaste, do you need to rinse your mouth with water?
Dr. Adewole, that's
Dr. Adewole.
Yeah, okay. Thank you very much. That's a very interesting question. Now, toothbrushing, the idea is to clean.
Thank you.
At the same time, there is a residual deposition of some of all these of the component of the toothpaste that I just mentioned. One of them is the fluoride. The fluoride helps to remineralize the weakened surface of the tooth. So if you actually brush and you rinse immediately, definitely you are removing those components almost immediately. But there is what we call minimal rinsing after toothbrushing. This is what I usually suggest to patients, is that if you want to brush the kind of your toothpaste, you can divide it into two. Use half to brush your teeth. By the time you brush, it will gather all the debris and whatever, rinse that. The remaining half, use it also to brush. At this one, your mouth at this particular time is cleaner. Spit it out, rinse minimally so that you still have some the remaining fluoride in your mouth to help you to for the few minutes immediately you finish, you still be there, be advantage and beneficial to your oral tissues. But if you just brush immediately and you rinse them out, definitely they will still be there, but the concentration will have been reduced compared to somebody that do minimal rinsing. Thank you.
Thank you so much.
Prof wants to add anything to that. But,
now let's get through the questions and we can then, maybe revert back.
And let me pick up a few comments from Dr. Greg. He says, we need to emphasize that nutrition starts in the mouth. Ancestral preparation of food and its quality is 1,000% different than what we do today. Today's manner of food preparation necessitates use of all these things we are mentioning. So that's a comment from Dr. Bill. And of course, there have been some comments on the urine discussion. But let me pick one from Monique Williams, who says, to anyone wanting to experiment with the urine, they should be careful nowadays. There is a thin line with sexual harassment. How do you explain it was an experiment?
Oh my gosh. My point indeed. That was why I said it's not a topic or a subject on, it could be in the future on Medical Mondays, but definitely not tonight. Whose urine am I going to drink? Mine? Dr. Adewole's? I don't know. Monique, I'm on your side.
On that interesting note, let me introduce Medical Monday Moment.
Well, thank you so very much. I enjoyed a comment here before I even go to that from our brother, Boyega Emmanuel. Did you see that? Who said, once again, this has been a great outing, a rewarding experience, and profitable investment of time, attention, and money. Kudos to Medical Mondays team. I mean, thank you so much. We feel the same way. So we appreciate you. We appreciate your coming. I want to recognize one of our sisters here. And I think she has jumped out. Remi Duile, Commissioner Remi Duile was here, and she's running for office, but she was here for a good amount of time. And we appreciate her. We want to say thank you. And everyone else that is here. My Medical Mondays moment is this Monday, everybody on this platform. We just appreciate you. We appreciate hanging out together every Monday evening and, just growing a little bit more in how to strengthen our health, to be stronger, so that we can live a healthier life. And I just want to appreciate every single one on the forum and say thank you for your participation. I want to ask that you please text me, email me, whichever one is comfortable for you, to ask for or to suggest topics or what you would like to see on Medical Mondays. I want to say that we turned 1 year on March 1st. Hey, 2022. March 1st, 2022 was exactly a year that Medical Mondays started. And we've been here every week grinding. The session last week on toxic relationship actually concludes that year. And we are very grateful for that. God has been faithful. And it's all happening because of you all. That's why I said Medical Mondays is about all of us. Thank you.
Thank you so much. Dr. Adewole, your concluding statement.
Thank you, Mr. Honorable Gustav, for your efforts. I would like to just use the opportunity to appreciate everyone for your comments and contributions. It's been a moment, a society moment, spending time with you. What I just want to say is that Medical Mondays has been very impactful, teaching, empowering people how to undo their health. Oral health is not a solo entity. If you take care of your oral health, definitely, directly also, you are taking care of the body. For example, if one tooth is lost and the front tooth is lost, or maybe upper or the lower one, the impact may be different depending on the kind of personality the person is, and the impact on the mental health of that patient, of that person. We can't determine it, but these things are connected. They are connectivity with everything that we are dealing with. So oral health is connected to the general body system. And the key thing is that we also say is our diets, lifestyle modification, and we hope to get better. Thank you very much for the audience once again.
Thank you so much.
Honorable Gustav, before you conclude, I have to recognize some people on this forum. First of all, it's Pastor Dr. Ephraim Ajay and his lovely wife, my daughter, Pastor Dr. Hannah Ajay. Please release that, or undo your camera. Let's see your faces. Medical Mondays is going on every week because of God Almighty and these two. And I just want to appreciate them. I want to appreciate Honorable Gustav for always being there. When I had to travel and everybody said, no, you can't cancel Medical Mondays, I called on him and I said, look, you have to host for me. And he has been faithful, diligent since then. And I just want to say thank you. Dr. Ajagbe, oh my gosh. If you guys want to have real fun, come in before, between 6:30 and 7. I hear Dr. Ajagbe dissing me, all the time. I just want to appreciate you, sir. Thank you for being there, for always encouraging, always helping me with, even topics to fine tune them, and just being an excellent Egbon. Madam VP, she's going to get my behind after this. And you know what? I'll be ready, because she said I must not say this, but I'll tell you, she was the first to support this endeavor financially. Just like that, she just zelled me money. I want to say thank you. And she has never missed a Medical Mondays in the 1 year. There are many on this forum that have not missed Medical Mondays. I want to appreciate my children. They have been in support, my techie people. Sister Lola, oh my gosh. When you have people who get your back, when you know that you have friends, it's when people tell you the truth about you and don't mix words, when they really your blind spot. Sister Lola Aromolaro, I appreciate you because you call it as it is, and I love it. I should say also, Dr. Ajagbe called me one day and said, I have to stop doing this. That I love to do this. I should stop doing this. I need to get tissue. See, I have a tissue here that, I should do that to stop dabbing the sides of my lips or my mouth with my fingers. He said he noticed that it's an habit. That is somebody getting your back, and I appreciate it. My Egbons in California, oh my gosh, Mr. Okusonya, Mr. Duarte, my sister, Dr. V, so many people, Dr. Ogundipe, my father, in the Lord, my brother. Look, I'm getting myself into trouble because I'm calling names. Sister Auntie Tower, always there, always faithful. My brother, Dr. William Craig, oh my word. Even when things are going on, is there, it shows up. Look, all of you, I said it before, everybody on Medical Mondays, you make this thing, you make this happen. There's a first lady who I was claiming to see that, I didn't see on there. We have two first ladies there that I want to recognize. First Lady Mitchell, yeah, and my sister Monique. She will, even after hours, after all of this, she'll call me and or we text back and forth, to fine tune things. First Lady, she's always here. She was here. She might have hung up. Sister Lola brought her, and she had been always steadfast, always faithful. Everyone here, Sister Umi Campson, Sister Edna Ogona. If anybody knows what Sister Edna is going through day in, day out, you wonder, how do you do this? But she's always here on Monday nights, learning and, contributing. My big brother, Attorney Richard Williams. So many people, all of you, Auntie Susan Oshifade, even at work, she calls in and mutes the camera. Mr. Yomila Wal, even from Nigeria, would call in. Sister Busola George, she's always here. Even though we've not met personally, she's always here. Dr. T.
What happened? Did I win a prize?
Yes, you always a prize winner every day. So you missed everything. Yes, I didn't get into trouble. She didn't hear me, so I didn't get into trouble. That is cool. Dr. T, who, since I met her, actually she texted me one day and said, add me to the forum. I'm not on the forum. She reminded me one day, I don't know if you guys noticed that I missed sending email, I think once or twice. Dr. T called she texted me to remind me, where's the email? So thank you so much. Lentina, thank you, because I know you probably are work, calling in here. I just want to thank everybody. If I didn't mention your name, don't be mad at me. It's because of time. You are all appreciated. We all make Medical Mondays, and we will make it stronger. We need to learn about our health so that we can live healthier lives. What is going on in our world today is scary. The new diseases, even the old ones that are now taking a lot of grants. That is why Medical Mondays came to being, into existence. So I want to also finally thank Dr. Now, how am I going to say this? Dr. Cap and Jennifer Jones, because we started this together, and I'm so grateful. Above all, I really thank God for what He's doing and for what He will continue to do. I have learned so much, and I'm still learning. And tonight, Dr. Opeyemi, thank you so much. Dr. Adewole, you've been awesome. Appreciate you. Thank you. Honorable Gustav,
you're welcome.
To you.
Thank you so much, Dr. O, and thank you, Dr. Opeyemi Adewole, and to our audience who stayed with us, especially our international audience. I just want to remind you that this Sunday is daylight savings time. So by the time we meet next week, you will be joining us 1 hour earlier than you normally do. So remember that next week, you will join us 1 hour earlier than you normally do. If you're in Nigeria and you normally join us at 1 a.m., it means you're joining us at 12 a.m. If you're in Ghana, you'll be joining us at 11 a.m. Tonight, we discuss oral health, prevention and control of gum diseases, key to an optimal general health, with Dr. Opeyemi Adewole, who is a specialist in the field. Till next week, when we come your way with another interesting discussion, stay blessed and good night.